When we talk about the issue of oncology, this topic will remain relevant for many, many years to come. The fact is that a large number of people suffer from oncological diseases. And what's more, they are not properly cured. In other words, there is no adequate treatment. And that's why it causes fear in people. Fear that people might get this disease, fear that people could even die from it. Today, in this video, I will try to tell you a little bit about oncology, as well as about the methods that can be used to treat oncological diseases. So an oncological disease is a condition in which a genetic mutation occurs within the human body, causing a healthy cell to gradually transform. A certain defect occurs in the cell's DNA, in its genetic material, and as a result of this defect, the cell becomes a mutant. The mutation causes the cell to become a mutant, and this mutant is called a cancer cell. And any cell in our body can become a mutant, can become a cancer cell, if it is exposed to certain factors that cause damage or a defect in the DNA of that cell. So when this defect begins and a cancer cell appears in our body, the cancer cell gains 3 advantages over the healthy, undamaged cells. The first is that cancer cells start to grow more rapidly. That is, there are cells in our body that also consume nutrients and grow, but a cancer cell, a cell with damaged DNA, begins to grow more, grow faster, eat more, and grow faster. Because of this, tumors develop. Cancer grows against the background of the other cells in our body. Second, a distinctive feature, cancer cells reproduce without reaching maturity. Normally, cells are first born, then they grow, and only then do they reproduce. But cancer cells acquire the ability to reproduce without reaching maturity. This is their unique characteristic. And when this kind of reproduction occurs, one could even say the reproduction of child, young, immature cells, then accordingly, the tumor itself will grow faster than the normal tissues of our body. And by the way, this determines how quickly the tumor will expand. If the cells divide at the very earliest stage of their development, when they are poorly differentiated, then such oncological diseases are also very, very malignant. Usually these tumors grow very quickly, or if the cell is highly differentiated, that is almost mature, then such tumors usually grow, well, still more slowly. The third characteristic of a cancer cell is that cancer cells do not die. Exactly as I just said, that is, every cell in our body has the ability to undergo apoptosis. Apoptosis is programmed cell death. As a result of cell division, when DNA divides, when chromosomes divide, there is a constant loss of genetic material during the process. And the newly formed normal cells always contain slightly less genetic material than was present in the mother cell. And over time, due to many, many divisions, the cells become more limited because their genetic material is constantly decreasing. This is how human aging occurs, the aging of human cells. But there is yet another feature. This process does not occur in cancer cells. That is, in cancer cells, during division, there is a 100% transfer of genetic material, and such cells do not age, and such cells do not die because the natural process of apoptosis, programmed cell death, that occurs in other cells does not happen in them. And when such cancerous cells, oncology, tumors, appear in the human body, they begin to grow very rapidly. They begin to break off and send their offshoots to other organs. This is called metastasis. Various organs are affected. Tumors grow into them, and a variety of other organs are impacted, not just the original site of the cancer. Friends, cancerous tumors are generally, though somewhat conditionally, divided into two categories: benign tumors and malignant tumors. And it turns out that everything depends on the degree of differentiation of the cancer cells. If the cell is more or less mature, then such a tumor is usually benign. But if the cancer cells are small, poorly differentiated, and divide very, very quickly, then such a tumor is malignant. Benign tumors mainly just grow, increasing in size, in volume. Malignant tumors grow through the tissue. Benign tumors usually develop slowly, while malignant ones usually develop quickly. Benign tumors generally do not produce metastases or offshoots, whereas malignant tumors, in addition to invading tissue, also separate and spread throughout the body in the form of these offshoots, metastases. And that's why a tumor from one organ can appear in other organs through its offshoots. This is how tumors develop. And in principle, they end up consuming a person because of their abnormal growth. How are tumors treated? The treatment of tumors, the treatment of oncology, is always standard. It consists of three main approaches. The first and most important is to cut it out. Look, if a person has grown something new, such as a neoplasm, the rule is that this new growth needs to be surgically removed or cut out. A radical solution to the tumor, and usually this helps if the tumor can be removed, especially if it is benign, has not metastasized, and removing the tumor results in the person no longer having it. In such cases, the person is considered attention cured of cancer. That is, there was an organ and there was some kind of tumor in the organ. If we remove the organ itself, removing it according to certain rules to prevent the spread of the tumor, then after the surgical removal, such a person is considered cured. Well, sometimes people are mistakenly and unfairly kept constantly under oncological supervision, as if they are still cancer dependent or with a predisposition and so on. But this is not always appropriate. It's unnecessary. If the surgery was performed and the tumor was removed, sometimes along with the organ, the person is left without the organ or part of it, but also without cancer. They are not considered an oncology patient anymore. But very often, yes, surgery is the method of choice. But very often it's impossible to do because, well, aside from removing the part of the tumor that can be detected, there is still a portion of the tumor left that cannot be surgically removed. And that remaining part can cause metastases, lead to spreading or regrow. In such cases, we use a second method, which is very commonly used in oncology. This method is called chemotherapy. What is its essence? The essence of chemotherapy is that a person takes extremely toxic substances. In fact, they are considered the most toxic of all medical drugs. These are cytostatics. Cytostatics work by stopping the growth, development, and reproduction of rapidly dividing cells in our body. In other words, a person takes this poison, which poisons their body, and as a result, all the cells in their body that were growing and dividing rapidly suffer from these pills, from these drugs, and stop growing and dividing quickly. Essentially, this kills off the organs in a person where the cells multiply rapidly. The liver suffers greatly, the skin is affected, hair follicles are damaged, people lose their hair, their mucous membranes are affected, ulcers appear in internal organs, and ulcers form in the stomach. But tumor cells are also destroyed. And that's why, to some extent, this is justified. But the side effects can be too toxic, and that's why the use of chemotherapy always requires a decision whether it is worth using and whether the toxic effects from chemotherapy might end up being greater than the potential harm from the cancer itself. That's why chemotherapy is sometimes used and sometimes it is not, strictly based on whether its use is considered appropriate to help the person. And the third oncology method that is very often used is the so-called Cannon method. That is irradiating the tumor. In other words, the area where the tumor was, usually after removal or when removal is not possible, is exposed to a large dose of some kind of ionizing radiation, X-rays, and this kills all the cells, literally all the cells, including the cancer cells. These are the so-called cannons. And when these cannons are used on the area where the tumor was, they are used to finish off and destroy the cancer cells. By the way, these cells become more sensitive to damage from X-rays. And if it is possible to finish them off, then at the site where the cancer was, a sort of prevention is carried out, preventing the possibility of the tumor growing again in exactly the same place where it had previously developed. These are the three techniques, the three treatment methods we have in our oncology practice. And now at this point, there remains just one important question. What exactly can Dr. Golod offer when it comes to cancer treatment? What additional things, if any, can be added to what already exists? Guys, there are several important features that I personally know about and that I regularly use in my practice to help people get rid of cancer. Listen, friends, the thing is, our bodies are constantly affected by factors that exist in nature, and they act on the DNA of cells, causing degeneration, causing genetic mutations. In other words, turning our healthy body cells into cancer cells, into mutants. And this process happens constantly. That is, we cannot protect ourselves from the effects of these factors. These factors are called carcinogens, meaning those that cause cancer. This includes radiation, chemical exposure to various substances, the impact of physical factors, and even the influence of certain biological factors, such as viruses, which can also cause mutations and lead to the formation of cancer cells. So, these carcinogens are constantly affecting our bodies, and because of this continuous influence on everyone, new cancer cells are, as you might expect, continuously forming in our bodies all the time. On average, in each and every person's body, approximately 20 brand new cancer cells are formed every single second, which is truly a staggering amount. Can you imagine that number? 20 new cancers arise in the body every second, but we don't encounter cancer as a disease that often. Why is that? A lot of cancer cells are formed, but the actual damage from them is not that significant. The thing is, friends, that over the course of its existence, our body has gotten used to being in an environment where a huge number of damages occur. And our body has a special anti-tumor defense. This is anti-tumor immunity. What is it? These are specific lymphocytes, white blood cells, lymphocytes that circulate in our blood and with the blood reach all organs and parts of the body everywhere. And these lymphocytes are programmed in such a way as to detect cancer cells. And once they identify and find a cancer cell, a broken mutant cell, they immediately destroy it. They even have a special name: killers, destroyers, assassins. They kill cancer cells if they detect them. And it is precisely for this reason that the activity of our anti-tumor immunity provides 100% protection of our body from the development of cancer. Do you hear that, friends? 100%. And that's why, even though so many cancer cells form in our bodies every second throughout our lives, the strength of our anti-tumor immunity is usually enough to cope with this. But that's usually. So why does cancer develop then? There are actually two reasons for the development of cancer, my friends. The first, if there is more toxic damage. For example, if a person simply lives and breathes ordinary air, 20 cancer cells form in their lungs every second. But when a person starts smoking, due to the toxic damage from cigarette smoke, more than 20,000 cancer cells form in their lungs every second. And this overload of toxins can lead to the immune system not having enough strength. Usually it is enough. But when there is a lot of toxic damage, then it might not be enough. And in such a case, the immune system might at some point miss a single cell just once. Didn't see her? There were simply too many targets that needed to be dealt with. And then that cell starts doing its job. It grows rapidly, it divides quickly, and it doesn't die. Of course, the immune system always detects cancer at any stage, but when it finds the tumor, it's already a developed tumor. The immune system fights cancer right up until a person's death, but it simply can't keep up. So the first reason cancer develops is because a person has significant exposure to carcinogens, unhealthy food, polluted air that one breathes, something harmful that comes into contact with the body, like what is called skin cancer if the skin is exposed, radiation, which affects all organs. And this large amount of carcinogens is a factor that will cause cancer. The second reason is when the level of carcinogens is normal, but a person has a weakened immune system. And when a person has a weakened immune system, then that immunity may not be enough to provide the usual initial basic protection against cancer. That's why cancer rates also increase when, for one reason or another, a person's immunity is reduced. For example, in cases of immunodeficiency, such as acquired immunodeficiency syndrome, AIDS, why does cancer occur there? Moreover, cancer can develop in any organ. This is the usual process of the formation of cancer cells, which should be detected and destroyed by the immune system. But they are not detected or destroyed because when immunity is weakened, there aren't enough immune resources to provide even basic protection against cancer. And that's why with AIDS, cancer can develop in any organ. And this applies not only to systemic diseases like AIDS, but also to other forms of immune suppression in humans. It is precisely the weakening of the immune system that most often leads to the development of cancer, the formation of tumors in humans. So what am I suggesting then? What method am I proposing? Guys, understand this. There is one factor, one pattern that always matches up. When a person experiences cooling or hypothermia of the body or certain body parts, it usually causes blood vessels to spasm. As a result, blood doesn't flow well to those areas, and immune support is also poor there. Immune support overall, both as protection against diseases and as anti-tumor immunity, that is in the parts of the body or organs that are cold, immunity is weakened. Immune protection is reduced. It is precisely in this part of the body that cancer can develop. A cell forms there as part of the normal process, but it goes unnoticed. Unnoticed by the immune system, it will begin to grow and develop. And so remember, there is one ironclad rule. Cancer grows from hypothermia. I understand how unusual this sounds compared to what we were taught since childhood. Don't warm it, you'll heat up the cancer, or cancer grows from heat. But this is a typical medical lie, a falsehood that was intended to kill as many people as possible. It has already been proven that immunity decreases due to hypothermia. When immunity is lowered, that's when oncology grows and develops. And so if you want to avoid cancer, you absolutely must keep your body warm. Following the principle of steam doesn't harm the bones. But what should you do if your body still becomes cold? I come across people who have cold feet, a cold lower back, cold chest organs, the surface of the chest, some parts of their body are cold. By the way, most often it's the feet. And it is precisely cold feet that are the cause of uterine cancer in women or prostate cancer in men. In other words, prostate adenoma and uterine fibromyoma develop as a result of cold feet. So what should you do if these parts of the body are cold? Well, it's not so easy to warm them up just using your body's own resources. So I usually warm up these parts of the body for the patient using certain medical devices for this purpose. What I'm showing now is a device made from tourmanium ceramic material. Just God forbid, don't confuse it with tourmaline. They are actually different things. Tourmanium ceramic is a special composite material that when heated gives off warmth similar to the warmth of my own body. And when I warm my body with this kind of heat, my body perceives the warmth from the heated tourmanium ceramic as its own, as familiar warmth. And it manages to warm my body as if the heating is happening using my body's own resources. That's why if you have any part of your body that is cold, cold feet, a cold lower abdomen, a cold prostate, a cold lower back, a cold back, or a cold stomach, these parts of the body definitely need to be warmed. For this, devices made from tourmanium ceramic are used. They are put on the body, on the legs, on the abdomen, on the back. A fairly high temperature is set, usually 50 or 55 degrees Celsius, and the warming process begins. Heating causes the blood vessels to dilate. More blood flows to the organs that were previously chilled. With the blood comes immunity, and this activates immune protection. At that point, the immune system does two things. It protects the organ from developing cancer in general, and it also causes the immune system to start fighting cancer if it is already present. And this is the best method, the best option for addressing cancerous tumors. We need to warm up those parts of the body, those areas that are cold. That's the first thing. The second thing I suggest is simply boosting the immune system by performing a procedure called cauterization. For cauterization, it's very convenient to use a device that I call a foot massager. These are special pyramids made from the same tourmanium ceramic which heat up to a high temperature. A person stands on them with bare feet and starts stepping, always with bare feet. And then due to the effect of high temperature on the feet, on the soles, cauterization occurs in this area, a specific process in which, because of overheating certain parts of the body, there is an activation of special substances, mediators of the inflammatory process, or as they are sometimes called, heat shock proteins. They lead to a significant strengthening of the immune system throughout the body, which in most cases results in the cure of cancer, but through the resources of one's own immunity. And this method is primarily for those who are afraid. They are afraid of heat, thinking it will make the cancer grow. They are afraid of warming up in general, overall. They want to keep their bodies cold, although this is complete nonsense. The body loves warmth. And a foot massage with this kind of massager is another great way to boost your immunity. By the way, it is absolutely safe, and most people are not afraid of it. By strengthening the immune system as a whole. So friends, these are two methods that I am sharing with you now, ways you can work on your immunity, work on oncology in order to get rid of cancerous diseases by boosting your own immune system. That was the information for you today from Dr. Golod.